All right, good afternoon. We want to start off with our guest who is in Gaziantep. Ghada, are you on the line? We can see you. There we go.
Can you see me?
I can
Can
hear
you hear me?
I can see you. I'm going to ask the technicians to put you on the big screen so we see you in big. There we go. Perfect. So we're delighted to be joined by our colleague Ghada Eltahir Mudawi, who is the Deputy Director of Operations and Advocacy for the Office for the Coordination of Humanitarian Affairs. She is joining us live from Gaziantep in southern Turkiye, where she just arrived, and she'll obviously be briefing you on what's going on in the earthquake. So, Ghada, please, you go ahead, and I know you have a hard out, I think, around in about 25 minutes or so. So please go ahead, and then we'll take some questions.
Thank you so much, Stefan. Thank you, and I hope you can hear me well. So we are here with the team who had been since the offset of the earthquake as well, and we are trying to provide humanitarian assistance for those who are most in need. Just to give you a bit of figures of what's happening, only yesterday from earthquake, we had 195 civilians who had been reportedly injured from Aleppo and Idlib, according to the initial reports. And there are further damages that had been caused to buildings which had been affected by the first two earthquakes before. The UN and our partners were continuing to scale up our cross-border aid operation from Turkey into the northwest of Syria. Earlier today, 38 trucks from World Food Programme, the UN High Commissioner for Refugees, and the International Organization for Migration had crossed through Bab al-Hawa and Bab al-Salama into the northwest of Syria, delivering food and other supplies. Since February 9th, we had a total of 265 trucks carrying aid from 6 UN agencies that crossed to northwest Syria from Turkey through Bab al-Salama, Bab al-Hawa, and Bab al-Rai. These assistance are including food, shelter, cholera testing kits, and high-energy biscuits. The local partners, national partners as well, are distributing aid on the ground. Rapid assessments found that shelter, winterization, and cash are the top priorities for the displaced people. Healthcare needs are also urgent, as we've seen that 20% of over 600 communities that had been assessed, they have no access to healthcare as we speak. Colleagues, it's very important to keep in mind that even before the earthquake, this situation had been very dire, and humanitarian situation had been very difficult for the people. Food prices were already skyrocketing. On the second week of Feb, the prices for commodities like bread, lentils, vegetables, sugar, and rice had increased drastically. And now this is the earthquake is happening after this situation. Just to mention on the funding aspect of the flash appeal that had been launched to the response to the earthquake in Syria, 17% only had been funded so far. So injection of funds and resources definitely needed. Estefan, do you want me to stop here and over to you to take if there's any question in the room?
That would be great. Thank you. Deji?
Oh, how do you know I have a
because
question?
I could see your hand twitching.
Okay. So, Ms. Mudawi, I have this question because you just mentioned some of those items that needed most in the area. So can you tell us what's the most urgent thing you need to deliver to those people? And secondly, we know that yesterday there were two additional earthquakes happened in that region. How much impact does these two earthquakes have for your relief operation? Thank you.
Go ahead, please. Thank you.
Stefan, do you want me to take one by
Yes,
one?
please. Thank you.
Okay. So if we go for the most needed items, we will say shelter at this point, food and cash. If we take shelter, just to give an idea about what's happening, people have been living in tents, but those who had been impacted by the earthquake had left their homes, and they are in need of shelter under a very harsh winter conditions. With the earthquake that happened yesterday, those where their houses had been tested and say that it's good to go back to live into, had left them, and definitely they are in panic, and they will not go back to live in these houses. So the estimation previously for those who are in needed shelter is no longer now standing, and we need to add those who left their homes in fear or because these homes had been impacted in the new wave of the earthquake that took place last night. In terms of how we are impacted, we are still delivering. Humanitarian workers and frontline local actors are still there. The impact is in terms of the added humanitarian caseload as we speak. People who need more support, winter conditions are very high. Cholera, over 47,000 cases are already there, and access to quality drinkable water is not the case. Health system is overwhelmed, health facilities impacted by the earthquake, and the level of trauma cases is just adding to this burden. This to keep in mind as well is that chronic disease and secondary health care remain also one of the main challenges. Over from my side, Stefan.
Thank you. Pam?
Thank you very much for the briefing. It's Pam Falk from CBS. Can you, first of all, a clarification. The cholera is on both sides of the border, I assume?
The cholera is in the northwest.
Okay. And are there any trucks not getting in to the Syria side?
No, none. All the trucks are moving through 3 crossing points: Bab al Hawa, Bab al Salam, and Bab al Rai.
Okay, and the final little piece is on the cholera, what is being sent? Medical supplies? I mean, can you elaborate? Thank you.
Medical supplies have been sent. Other additional supplies are on the way. As I said, on 2 days and since the 9th of February, some of the trucks that went also with cholera testing kits, and cholera vaccination campaign also will restart after it had been interrupted by the earthquake.
Thank you.
Thank you. Ephraim, Arab News?
Thank you. Ms. Ghada, what about water provision? I have a series of short questions. Water, are you being able to deliver water to some of these people? We know it's one of the main reasons why cholera is spreading, is the lack of water.
Yes, it is still trucking. Water delivery is continuing, but it's water trucking.
Okay, and are there still communities that you have not been able to reach yet? We're still hearing about people that have not received any aid in some villages. Is this still the case, or are you confident now that you are able to reach the areas that were not accessible in the beginning?
We are confident that the efforts had been increased drastically than the previous days, definitely. As I said at the beginning, our colleagues, everyone was on the shock of the earthquake. The system, this is one of the rare situations where those who are responding to a crisis were also impacted by it. So it took some time. We have still colleagues in the office who had lost family members, who are spending nights in cars. Last night we spent the night outside in the street because of the earthquake. So it's quite stressful to see how the first line responders are being impacted. But now the system is definitely gearing up, reaching more people. I can see also from my colleagues when we crossed as UN personnel as well and be in touch with the communities. This is the first time in 12 years that we not only sending aid through trucks to cross the border, but actually being there among the people, talking to the mothers and children and putting faces to the figures and numbers and visiting communities, being physically in Afrin, in Jandaris, in Sarmada, in Dana and elsewhere. This is definitely a game changer, that we are there among those communities and seeing firsthand not only the level of destruction that the earthquake had caused, but the impact of enduring 12 years of the conflict and displacement.
And just one last one. We see a lot on social media, there's this sort of anger in the Northwest directed at the UN because of the slow pace of things in the beginning and, you know, accusations that not enough trucks are entering, and all of that. I'm sure you followed all of that. Do you feel now the atmosphere has changed? How are your people being treated on the ground by the local populations?
Myself, I had been inside in many of the areas. My colleagues also, we went in different convoys. We had been received like with the generosity and the hospitality of the people of the Northwest Syria and the Syrians. The anger, they have the right to be angry. This is not a level of a crisis that you see every day. This is an immediate impact on them. And you can imagine the first 72 hours, the first 5 days, 6, 7 days, where children and people are being trying to get their beloved one from the rebels. I have a colleague here with us in the office who tried to save his parents, and luckily he did, and he managed to do that. So being angry, definitely, they have the right to be angry. The first search and rescue was not on time, but now humanitarian aid, saving lives, those who survived the earthquake, they need to be saved, they need to be accessed by humanitarian assistance, and this is what we are doing now. What we don't want to have is to be short of resources and is to be short of our ability and capacity to continue to reach them through all crossing points as quickly as possible and as much needed as possible.
Thank you. Abdullah?
Thank you, Madam Mudawi. Abdullah Imasi from Al Arabi TV. Madam Mudawi, some news report that Syrian regime forces is again bombarding Afs, Sarqab, Idlib in northwest of Syria, the areas distressed by the earthquake. First, can you confirm this and how that can affect your humanitarian effort? Thank you.
Thank you so much. I cannot confirm or deny we were not in these areas. We had been entering to different locations, as I mentioned them. We did stay on ground. We did spend quite remarkable time with the population, talking to women groups, visiting emergency shelters that had been provided, but we were not in the areas that you have mentioned.
Thank you. Any other questions? Anything online? Excellent. Listen, thank you very much. We'll let you go back to work, and we hope to have you back here, Ghada, to report back, as this will clearly be a long-term operation. But thank you for beaming in, and take care.
Thank you so much, Stefan. See you.
Bye.
Thank you. Bye.
Okay.